everyone, and welcome to this episode where we'll be talking about unshaven female hair transplant. Patients who keep their existing hair can use it to cover the donor area and the recipient zone while the early healing phase. The main reason is practical. This makes the procedure far less noticeable to others. Shaving is still the standard preference from a surgical standpoint as it improves the visibility and precision. But when a patient requests the unshaven technique for personal, social, or professional reasons, an experienced surgical team can accommodate that without compromising the outcome. In female hair transplantation, the unshaven approach is primarily a cosmetic preference. Medically speaking, shaving can actually make the procedure easier in terms of visibility and speed. However, many women prefer not to shave their hair because of social, professional, or emotional reasons. And that preference is completely valid. So the unshaven technique is chosen to maintain discretion, not because it improves the medical outcome. From a surgical standpoint, the success of the transplant depends on technique, graft handling, and planning, not on whether the hair was shaved or not. The biggest difference lies in candidacy and surgical planning, not the technique itself. Both men and women who are suitable candidates for a hair transplant have androgenetic alopecia, also known as male pattern hair loss. This is the underlying condition that makes transplantation viable in the first place, because it means the donor area at the back and sides of the scalp remains stable and DHT resistant. During extraction, the donor area must still be clearly visible to avoid damaging surrounding follicles. During implantation, surgeons must carefully separate existing hair to create precise angle and avoid transection. It requires experience and patience because we are operating in a much more crowded field. In unshaven female procedures, the goal is discretion because the surrounding hair remains intact. Redness and early healing signs are often partially hidden. Most patients can return to daily social activities much sooner compared to fully shaved procedures. The risk is not inherently higher, but it requires greater technique control. Working between native hairs demands precise angulation and careful placement. The surgeon must avoid damaging existing follicles while inserting new grafts. In female hairline, especially angle and direction are critical. It can be more complex. Since we are blending new grafts into existing long hair, the implanted follicles must follow the natural flow perfectly. Otherwise, the difference becomes visible when hair grows out. Transplanted hairs often enter a temporary shedding phase within the first few weeks. However, because surrounding hair is still present, this phase is usually less visually dramatic than in shaved procedures. Long hair itself does not slow healing. What matters is proper postoperative hygiene and following washing instructions carefully. As long as the scalp is kept clean and untouched during the critical first days, infection risk remains very low. Washing usually begins within a few days under medical guidance. Styling with heat tools, tight hairstyles, or chemical treatment must wait several weeks. The first 10 to 14 days are focused entirely on graft stabilization. Thank you for following this episode. Check our socials for more female hair transplant journeys.